The second part of the preceptor education is to go through feedback and debriefing, to provide critique and allow students to ask questions about certain situations. Portions of this preceptor education have come from the presentations given at the Athletic Training Educators Conference titled Utilizing Successful Feedback Techniques to Develop this Preceptor-Student Relationship to Improve Critical Thinking by Kyle Schneider of Southeast Missouri State University and Greg Williams of the University of Kansas, and Facilitating Effective Debriefing by Kirk Armstrong of Indiana State University and Brian Vesky of Northwestern University. If you would like access to either of these presentations, please let Jacqueline or Joe know. What is critical thinking? It is an objective analysis and evaluation of an issue in order to form a judgment. Critical thinking is not telling students what to think. They must be able to work this out on their own for them to effectively critically think. Now ask yourselves, why is this important in the field of athletic training, or in any other healthcare education for that matter? What makes a good critical thinking clinician? What barriers are there to critical thinking? Why is critical thinking important? Some quotes about critical thinking emphasize the importance of critical thinking, regardless of what students are studying in school. We should be teaching students how to think instead of we teach them what to think. It is strange that we expect students to learn, yet seldom teach them anything about learning. We often focus on treating one or two patients and performing routine tasks, not on developing critical thinking. It is important to help our students with their critical thinking skills to help them become better clinicians. There are a number of barriers to critical thinking: lack of training, lack of information, preconceptions, and time. To overcome these barriers, the remainder of the presentation will provide resources and tools for you, the preceptor, to help our students become better critical thinkers. To help with time, an example of the 1-minute preceptor will be described later in this presentation. One way to overcome the barriers to critical thinking is the utilization of the critical thinking ideals. They are: identify the problem, define the context, enumerate the choices, analyze options, list reasons explicitly, and self-correct. While going through both the feedback and debriefing portions of this presentation, please keep in mind how you, the preceptor, can help our students develop better critical thinking skills. The first section of this presentation will address feedback, and the second part will address debriefing. What is feedback? Feedback, by definition, is the information about reactions to a product or a person's performance of a task used as a basis for improvement. How can you, the preceptor, use feedback to constructively provide critique? There are two types of feedback that can be used to effectively critique students: corrective and guiding. With corrective feedback, the preceptor should be identifying if the student is performing a skill accurately and correctly. Are they using the correct tape for a specific tape job? And are the steps they are performing for the tape job correct? With guiding feedback, preceptors can have students think outside of their current situation to see if there are any other scenarios that may present themselves similarly. The patient complains of knee pain when going up the stairs and squatting. You suspect patellofemoral pain. Are there any other pathologies that present in a similar fashion? The 1-minute preceptor is designed for the preceptor to give quick feedback to students when time is limited, but have the ability to provide feedback to the students. Each quadrant is a way to provide constructive feedback with one sentence. The first is continue. This is where the preceptor positively reinforces the student's actions that they are doing well. Examples can be: continue to let the athlete talk, continue to be a good listener, continue not leading conversation in a specific direction. The second is begin to do more. What can the student do more of to enhance their abilities? Examples are: ask more probing questions, take more initiative, and communicate with the patients. The third is consider. This is something that might be a stretch for the student to start doing, but it may give them something to think about for the future. For example, being patient about asking a question that is accusatory, doing a certain special test toward the end of your evaluation that may cause the patient discomfort. The fourth is do less or stop. This is where the preceptor can address behaviors or actions that may or may not be appropriate for certain situations. For example, stop saying, "I know how you feel," or do less overthinking with your skills and knowledge. Other ways to provide feedback are to create certain situations that your student may not have a chance to experience firsthand. Here is an example of a critical thinking scenario. Homecoming football game. Your running back sprains his ankle. The physician prescribes pain medication and muscle relaxers. Since it's homecoming weekend, you have overheard that there will be some parties for student athletes. What conversations do you have with the patient about the activities for the evening? Have your student respond to the scenario, then provide them the feedback after they've completed their response. In the second scenario, you are working with a men's basketball player who tore his ACL. He had surgery over the winter holiday with a physician at his hometown. The operating physician has a totally different protocol than the team physician, limiting open kinetic chain knee extension exercise for 3 months. How do you approach the situation? Again, have your student respond to the scenario, then provide them feedback after they've completed their response. While these scenarios can take time to create, they can provide students with situations that they need to handle but have not yet had the opportunity to experience during their current clinical experience. The next section of the presentation is debriefing and understanding its differences from feedback. What is debriefing? Debriefing is a facilitated, planned conversation where individuals analyze their actions, thought processes, and emotions with the goal of improving patient care and outcomes. Debriefing requires two-way communications between the learner and the facilitator. It involves deliberately planned questions that foster insight into behaviors and decisions. Participants analyze their actions, reflect on their thought process, and ultimately assimilate improved behaviors into clinical practice. It can also be used to evaluate students' soft skills such as communication, proper terminology, and professional behaviors. Now that you have a better understanding of what debriefing is, what are you trying to achieve? Effective debriefing can result in metacognition, or awareness and understanding of one's own thought process, changes in attitude, changes in patient care behaviors, compliance of the student or clinician, and adherence to clinical practice behaviors. What debriefing is not. Debriefing is not a comparison of an observed behavior and performance standard. The purpose is not for the facilitator to point out what the behaviors or actions were correct or incorrect. Leave that for feedback. Debriefing is not provided with the intent to improve performance. It should foster critical self-reflection. The context for debriefing can be broken up into 3 categories: educational scenarios, patient care scenarios, and critical events. Each type are used to provide the student with different situations in different settings, different types of patients, and the criticality of an event. Providing scenarios in each category can help a student understand how to handle each from a skill and an emotional perspective. Why is debriefing needed? Debriefing after a patient care encounter has been shown to improve critical thinking, improve confidence, improve clinical skills, and improve clinical reasoning skills. With all of this in mind, facilitating effective debriefing can be challenging. There are psychological dangers and safeties that can occur based on the debriefing environment. If the environment does not feel safe for the students, they may react negatively by not sharing their mistakes, blaming others if something went wrong, have the fear of being criticized by their preceptor or peers, and falling into the common knowledge effect where everyone has the same response and individuals do not speak up about their feelings or assessments. If the environment is psychologically safe, students are more likely to respond independently and effectively. The environment promotes honesty and non-judgmental opinions or reactions, which can allow the students to learn from each other and improve themselves. To help foster this environment, during pre-simulation, be sure to clarify objectives of the simulation, define the roles of each student, maintain confidentiality throughout, and provide clear expectations on why you are doing the simulation. There are 4 phases of debriefing: reactions, description, analysis, and the summary. In each phase, there are specific questions that you should be asking your students so they understand what happened, their role in the situation, how they felt during and right after, and what they learned overall from the situation. Whether the situation is a mock scenario or something that happened in real time, it is important to address all of these aspects to get a full effect of the debriefing. There are a number of challenges to overcome to create a good debriefing scenario. The first is creating a safe and comfortable environment. Students should feel comfortable expressing their mistakes and learning from them. The second is developing a debrief guide when designating learning objectives. All questions asked should parallel the learning objectives for the scenario and encourage reflection on actions. The third is the use of debriefing diamond, which will be thoroughly explained on the next 2 slides. The use of the diamond is to provide a standardized approach that scaffolds questions to facilitate reflective processes. The debrief diamond is taken from the 2014 article Promoting Excellence and Reflective Learning in Simulation. The role of the pre-simulation debriefing by Epic and Cheng in the Journal of Simulation in Healthcare. The diamond begins with the description of the activity and the role each student played. Additionally, it should be reinforced that what the students discuss is safe and will not be judged or exploited. Moving into the analysis, transitioning from what happened to how the students assume their roles in the situation. This is where more of the behavioral deconstruction and analysis by having the students reflect on their actions. The preceptor should avoid strengths and weaknesses feedback here. Save that for another conversation. Finally, transitioning to the specifics of the scenario and how it can be used in general patient care practice to reinforce learning. Break down their behaviors into small actions and allow them to think about other situations that might apply to what they did or did not do. Ask what the students would do differently and why. How would it have changed the outcome? Here is the debrief diamond with words and phrases that can be used on each section to go through each part of the debriefing process. In the description section, asking the students what happened, allow a response, and then continue asking what happened until all the details of the scenario are described. Try not to have them focus on performance, but more about the situation. Explain why the scenario was designed if it was a simulation. If the scenario was in real time, discuss the cause of the incident if known. Have the students discuss their feelings about the situation. Allow them to speak. Silence is important here as the preceptor should not lead the students' emotions. Ask why they felt a certain way and why. Clarify their feelings so you can be on the same page. This may help you understand why the student acted a certain way during that situation. Finally, move into how the situation can be similar to others. How could this be translated into a different scenario? What would they do differently if the situation happened again tomorrow? All these questions can help the students prepare for situations that they may encounter once they are certified athletic trainers to help provide the best standard of care for their patients. The final challenge that can be overcome in the debriefing process is attending professional development to continue to educate yourself. There are a number of workshops, training, and journals that focus on debriefing that can help continue your education in this process to contribute to the clinical education of athletic training students. This concludes our preceptor education presentation. If you have any further questions about the program, any of the materials used, or references, please feel free to contact Jacqueline. Once again, thank you for being a Salem State University preceptor.